When pregnant, did you take an antidepressant, anti-anxiety medication, including Prozac, Paxil, Celexa, Zoloft, Effexor, and bupropion, which is sold under the brand name of Wellbutrin and Zyban? Did your child suffer from a birth defect? SSRIs are suspected of causing serious birth defects involving the heart, lungs, brain, head, face, and limbs. In the heart, defects include anatomical abnormalities. Concerning the lungs, in a study reported in the New England Journal of Medicine in 2006, it concluded that if SSRIs were used in pregnant women to treat anxiety and depression, there was a 6 times greater risk of PPHN, persistent pulmonary hypertension of the newborn, which is a potentially fatal lung defect caused by oxygen deprivation at birth. In a study at the University of British Columbia concerning the use of SSRIs in pregnant women, it reported an increased risk of preterm birth, low birth weight, and the development of respiratory distress. Quoting Dr. Tim F. Oberlander, the lead investigator, "Our study was undertaken to distinguish the effects of maternal mental illness, pregnancy-related depression, from its treatment, SSRIs, on neonatal outcomes. The study examined health data for 120,000 live births. 14% of the mothers were diagnosed with depression. The researchers compared outcomes of babies born to 1,451 depressed mothers treated with SSRIs during pregnancy, and of those born to 14,234 depressed mothers who were not treated with antidepressant medications. The study documented that there was a significantly greater incidence of respiratory distress, 13.9% versus 7.8%, and longer hospital stays for infants born to depressed mothers on SSRIs than those born to untreated depressed mothers. Birth weight and gestational age were significantly less in SSRI-exposed infants, and a significantly greater proportion was born before 37 weeks. Regarding the brain, a study at Vanderbilt University, reported in the American Journal of Obstetrics and Gynecology, concluded that fetuses exposed to certain antidepressants may be more likely to suffer a seizure after birth. And involving the body, reported birth defects caused by the use of antidepressants in pregnant women include skull deformities, such as craniosynostosis, also incidents of clubfoot, and limb reduction. In a study reported in the New England Journal of Medicine in 2007, it showed that women taking antidepressants prenatally were more than twice as likely to have infants with skull and intestinal deformities. If you were prescribed SSRIs or SNRIs, antidepressant, anti-anxiety medications, when pregnant, and your baby suffered from any type of birth defect, call us. At the nation's law firm, we represent women and their children across the country injured by these drugs. We will provide you with a free evaluation of your case.